Good morning. Thank you for inviting me here this morning. In 2017, I was searching the internet for answers after the loss of my son to an accidental overdose. I discovered International Overdose Awareness Day, which began in Australia in 2001. August 31st is set aside each year as a day to remember lost loved ones, to learn more about the overdose crisis, and for communities to come together to make change. This year's theme, Together We Can, is a powerful statement of unity and hope. I want to spend a few minutes with you exploring what it means to say, Together We Can. The overdose crisis is complex and multifactored. No single individual, organization, or government agency can address it alone. It requires a collective effort, a shared responsibility, and a commitment to working together toward a common goal. A world, and especially our local community, free from overdose. The overdose crisis is a public health emergency that has touched countless lives. I don't have to tell you that it has a personal impact on individuals and families, and that it also impacts our local communities. Although we lost 123 lives in SLO County in 2021 to overdose, that number has gone down. There were 103 deaths in 2022 and 106 in 2023. Amidst the darkness, there is a glimmer of hope. We have the tools, the knowledge, and the capacity to turn the tide. Harm reduction is at the heart of this effort. Harm reduction is a compassionate, evidence-based approach that seeks to minimize the harms associated with substance use. It is not a cure-all, but it is a lifeline for countless individuals. Harm reduction strategies such as naloxone distribution and needle exchange programs have been proven to save lives. Let me dispel some myths and misconceptions surrounding harm reduction. It is not enabling, it is empowering. It is not condoning drug use, it is recognizing the reality of addiction, keeping people safe, and providing a pathway to help. Harm reduction is about meeting people where they are, offering support without judgment, and building trust. But harm reduction is just one piece of the puzzle. We must also address the root causes of substance abuse, such as poverty, inequality, mental health, and trauma. We must invest in prevention programs that educate our youth about the dangers of substance abuse and provide them with the skills and resources they need to make healthy choices. We must expand access to quality treatment and recovery services and create communities where individuals in recovery can thrive. And let us not forget the importance of compassion and empathy. Addiction, or substance use disorder, is a disease, not a moral failing. It does not discriminate and can happen to anyone. Those struggling with substance use are our friends, our family members, our co-workers, and our neighbors. They deserve our understanding, our support, and our unwavering belief in their ability to recover. I want to emphasize this: substance abuse is a disease. I know that when dealing with my son during his dependence on drugs, it was a big turning point in our relationship when I accepted that he was struggling with a mental health challenge and not intentionally pursuing a lifestyle. No one wakes up one day and decides to become addicted. Together, by learning about harm reduction and practicing compassion, we can break down the stigma that surrounds substance use and create a culture of acceptance and inclusivity. Together, we can advocate for policies that prioritize prevention, treatment, and harm reduction. Together, we can invest in programs to develop new and effective interventions. And together, we can build a future where everyone has the opportunity to live a healthy and fulfilling life. The 6th annual SLO Overdose Awareness Day event will take place next Saturday, August 31st, from 2 to 4 at Mitchell Park. It will feature a resource fair with over 20 participants, a speaker panel, an active listening center staffed by counselors, opportunities to create memorials, and will close with a candle lighting ceremony. As we observe Overdose Awareness Day, let us remember those we have lost and recommit ourselves to the fight against this epidemic. Let us honor their memory by working tirelessly to prevent future tragedies Let us come together as a community, united in our determination to create a brighter future for ourselves and for generations to come. Together, we can.